What happens if a PET scan for colon health is unclear? Imagine getting a scan to check on your colon and the results are not clear. That can be confusing and even a little worrying. When a PET scan for colon health produces unclear or equivocal results, it means the scan cannot definitively say if there are cancerous or abnormal areas. Several factors can cause this. Small tumors might not be visible because they are too tiny. Some types of tumors have low metabolic activity, so they don't absorb enough of the tracer used in the scan. Inflammation or infections in the colon can also cause increased activity, making it hard to tell if a spot is cancer or just a benign issue. Technical limitations of the scan itself can also play a role. When results are unclear, doctors usually recommend additional tests to get a clearer picture. A common next step is a colonoscopy, which allows doctors to look directly inside the colon and take tissue samples if needed. This is often the most accurate way to identify or rule out cancer. Sometimes, doctors order contrast-enhanced computed tomography or magnetic resonance imaging scans. These provide detailed pictures of the colon and surrounding tissues, helping to locate any suspicious areas more precisely. In some cases, repeating the PET scan after a period of time can help see if anything has changed or grown. It's important to understand that PET scans work by detecting areas of increased glucose metabolism using a tracer called fluorodeoxyglucose. While this is effective for many cancers, some early-stage tumors or certain types like mucinous adenocarcinomas may not show enough activity to be detected. Also, benign conditions like inflammation or infections can cause increased tracer uptake, leading to false positives or ambiguous results. That's why PET scans are often combined with CORT scans. This fusion helps doctors match metabolic activity with specific anatomical structures, reducing uncertainty. Still, even with combined imaging, some results remain inconclusive, especially if there has been recent treatment or inflammation. After treatments like chemotherapy, the tumor's metabolic activity may decrease, making PET scans less reliable. This can cause results to be unclear or misleading. In such cases, other imaging methods like MRI or CORT scans might be better for monitoring progress. When PET results are not definitive, doctors consider all available information, symptoms, lab tests such as carcinoembryonic antigen levels, and other imaging studies to make the best decision. They may decide to perform a biopsy or plan surgery if suspicion remains high. Interpreting unclear PET scans requires experienced specialists. Nuclear medicine physicians and radiologists trained in cancer imaging are essential for distinguishing between normal tissue, benign issues, and potential malignancies. They carefully analyze the scan's details to guide the next steps. Overall, an unclear PET scan doesn't mean a diagnosis has been missed. It highlights the need for further testing and careful clinical judgment. Patients should always discuss these results thoroughly with their healthcare team to understand what they mean for their individual situation and to plan appropriate follow-up. Remember, each case is unique, and medical decisions are made based on a combination of tests, symptoms, and professional expertise.